I know the struggle is real. I'm here with you. Like I said, I'm in this journey with you. So I always start with nutrition, even though we have the 6 pillars in lifestyle medicine, because I believe that nutrition makes the biggest impact, especially for reversing chronic illnesses. Like if you don't change your nutrition, you don't change really the chronic illnesses for the longer term. And I got that from another doc when I was learning about nutrition, when he said you cannot out exercise a bad diet. And because I was an exercise person after I learned to do things for my own health. But then when he said that, I'm like, okay, nutrition has to be number one.
Hello, everyone. This is Dr. Anita Lwanga. I have my friend here, Dr. Amanda Adkins. We're going to talk about the role of spirituality, faith, and nutrition in living a healthy and abundant life. Dr. Adkins is a double board certified physician. She's board certified in internal medicine and lifestyle medicine. She's a health strategist and owner of Adkins Enlightenment and Lifestyle Medicine. She has a deep passion for ensuring that everyone has a chance to live a healthy and happy life. Recently, her focus has been on helping women who are overweight prevent and reverse chronic diseases such as diabetes, heart disease, and high blood pressure. And I am super, super interested as another fellow internist who does not have training in lifestyle medicine but knows the power of lifestyle medicine. I'm super, super excited to have you here on our show. The first question I'm going to ask you is to tell us a little bit about yourself. Tell us a little bit about your journey into medicine, your journey as an internist, and how you pivoted your focus into lifestyle medicine, because this is something that I think a lot of us have maybe an inkling or an understanding that medicine should incorporate what we do in our day-to-day lives, but we may not have the skills, the tools, or the training to understand how powerful this is.
Yes. So thank you first for having me on your podcast. I really appreciate it. And the question is so full. Like I'm trying to think of where to start, but how I got into medicine. So I always give a shout out to my 6th grade teacher, Mr. Ivy. He was teaching on health at the time, where we actually learned how the blood flowed through the heart and through the body. And no one in my family is in medicine. I never heard of medicine at the time. I knew doctors, but I never thought that's what I would do. I wanted to be a math teacher because I love math. And then I started to hear how he was teaching, and I was like, the human body is fascinating. I want to do this. And so I went to the library and started looking up things on what it was like to be a doctor, and learned that there was different specialists out there. Again, I didn't go to a doctor, didn't know too much about it. And so I learned about the field of cardiology, and that was my first inkling of medicine. And then my grandfather took me to meet with his cardiologist, and I was like, oh man, this is a real thing. I can actually do this. And this was like back in the 80s, likely. And at the time, I looked up and they were making like $90,000 a year. And I'm like, oh my gosh, that's a huge amount of money. I'm going to do this. So I just look back at that and like, it's just fascinating to see. But that got me interested in medicine. And then I started to look up and see, how do I actually become a cardiologist or a doctor or a specialist, and learned that I had to go through med school and then residency and fellowship training and all that kind of stuff. And just to see what it was. And I was already a learner, so I just love that, reading things and just learning how to do it, and then just follow the path. Like, okay, this, and I'll do this. And having that, I guess, dream as a young child, not realizing the obstacles I would have to go through, or that it's not necessarily easy to just become a doctor. Like we're like especially for African American women, we're like the 2% of the physicians out there. But I wouldn't think about that at the time. It was a pathway, and I was just going to take it. And with the grace of God, I was able to do it, because otherwise I'm like, how in the world am I going to make it here? But each and every step was a pathway. It's like, here you go. I'm going to make a way. I'm going to make a way. And here I am talking about internal medicine, lifestyle medicine. So I picked internal medicine because initially, like I said, I was interested in cardiology. But once I actually got into residency, I love women's health. I love endocrinology. And then I was like, okay, well, let's see what I can do with just this here with internal medicine, because it was so many different things that I can put my hands on that I just loved about it. And then going into lifestyle medicine, it was a specialty that became, especially after I was out practicing actually internal medicine. So their board certification, I think, I haven't looked this up in a while, but it was either 2012 or 2014. And I finished residency in 2009. So I was out there, but one of my patients actually was telling me about like Dr. Joel Furman, which was like one of the fathers we think of like lifestyle medicine and things like that. But just looking into his work and then learning more about nutrition, it was like, oh my gosh, looking back over my own life, I'm like, I've been actually doing this for myself because I wanted to actually be healthy. I wanted to be a doctor that actually followed the recommendations that I told patients. And just from there developed into lifestyle medicine and then going on to help women who were like me with the overweight and having either a family history or personal history of diabetes, heart disease, and high blood pressure. So that's the overall gist of how I went into medicine and then went into lifestyle medicine.
Ah, that is awesome. Thank you for explaining that. I wasn't sure when lifestyle medicine became an official specialty. And I think we have a lot of similar friends, and several of our friends are doing lifestyle medicine. So I didn't have take the time to do the research, but thank you for explaining that. So, what layer does the extra training of lifestyle medicine add to the way you practice medicine as an internist?
So, lifestyle medicine, because we know that it actually helps with chronic illnesses, which we're dealing with day in and day out as an internist, it's like, oh my gosh, we forget that sometimes, even in the studies they mention with lifestyle, this medication, right? But they don't really harp on the lifestyle piece. And so we would just kind of glance over that. But because more and more people, patients actually were asking me, like, what else can I do besides medicine? That's what really triggered me to start talking about it to other people. Like I said, I started doing it for myself because I was like, I wanted to be healthy. I don't like medicine. I don't want to have the side effects of medicine. So I was like, what else can I do? And because they were asking me, I'm like, okay, well, let me actually figure this out. And it still wasn't until several years later. Like I said, I finished in 2009. The specialty came out in 2014. I didn't become board certified until like 2021, 2022, something like that. So it still was like I didn't even know lifestyle medicine existed at the time until later on. So I had to learn about that. And then it's during the research, having your own story or actually helping a patient with lifestyle changes, showing that you can actually demonstrate what you actually learned about and then put that into a patient life and actually see them actually make the changes. And then it's a test. And then, of course, keeping up with the certification. Every board certification has you do, but unlike internal medicine, which I love aspects of internal medicine, but not all aspects of internal medicine. But with lifestyle, it's like I love all the six pillars and I love talking about all the different things that lifestyle medicine can bring. And just thinking back how over my life, like each and every aspect of my life, how these different six pillars have played a role at different times in my life. And I'm like, oh, wow. So it's like I'm just a walking billboard for lifestyle medicine.
So you mentioned six pillars. What are these six pillars? And not to sound completely ignorant, but I'm thinking about our audience who are maybe not physicians, or even for other physicians who are like, maybe this is the missing link in terms of the way I'm practicing.
Yes. So the six pillars are a plant predominant diet or nutrition, movement is exercise, stress reduction, restorative sleep, social connection, and getting rid of toxic substances. So, like tobacco use, overuse of alcohol, things of that nature. And if you think about it, like you're like, oh, all those are different aspects of my life that actually can impact my health, right? So I just love all aspects of those things. And the one that was the most surprising to me, to go off a little bit, was the social connection piece. And we didn't really, I don't think a lot of people really emphasize that until after the COVID pandemic, where we were separated and realized how much impact that had on our health. But there are studies that go back years that talk about how social connection people live longer, happier lives if they have that good connection with a group of people. So that was something I didn't know at the time, but I was like, oh, that's so enlightening. I love it.
Yes, thank you for sharing that. I think that's extremely important. And I think in our Western world, where we're so technology driven, we forget some of the things that seem almost common sense, or we think we're superheroes, especially when we're young, that I'll be fine if I don't eat a healthy diet or I don't sleep enough or I
Mhm.
don't do X, Y, Z, Z. So I think as physicians, it's good for us to have those ways of connecting with our patients or helping our patients that are very practical, that are not just based on writing another prescription. And I can totally relate to what you're saying in terms of having patients who are like, I don't want to take pills. I think a lot of people, if they knew there are other things you can do besides taking medications, I think it would make a big, 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 big difference. So thank you for sharing that. I want to pivot a little bit and ask you about spirituality. So you mentioned that spirituality is part of your practice as a physician and it impacts how you interact with your patients. Tell us more about that. I think that's something that not a lot of people talk about. So I'm very curious and I'd like to hear your thoughts and your perspective.
Yes. So again, it goes back to me as a child. So I grew up in the church, Christianity, and always wanted to learn, was like an only person, I'll say young person or teenager, usually at the Bible studies, really trying to learn like how this is going to impact my life. And being called later on, like the Lord was like, okay, so you have this unusual beginning of having become a physician from a family that didn't have any type of medical people in their family. And then you actually grew up in the church, actually learned about me. And now you see how so many of my leaders are actually being diagnosed with these chronic illnesses and the impact it's making on the kingdom of God. Okay. So again, I wasn't trying to get this, but it's just like that's just what naturally came as life went on. And the Lord started speaking to me is like, I need you to speak up, and especially to my people about how they're treating their human bodies and how it's impacting their work for the kingdom. So I use different scriptures to help with patients that are having trouble making the behavioral changes. Because usually that's what I hear that, oh, I know what to do, but I have trouble doing it. And I was trying to think of a way to actually talk with the people that actually resonated with them deeper than saying, well, this study said this or this study said that, or even telling them about my own story. But when they actually have a deeper connection, when they actually want to have a deeper connection with God, and then I bring up biblical scriptures for them to actually how it points back to how their own health and how they're treating their body, they look at it a little bit different. They're like, oh, okay. Well, I didn't think of it that way, that my act of worship is actually making sure my body is healthy. Okay, so like one scripture I use is like your body is a temple of the Holy Spirit, and if you're housing the Holy Spirit, would you want it to be like dirty inside? And so I use the analogy of like you don't have people over to your house that's like, oh, I haven't cleaned up, right? And so they're looking like, oh, I understand what you're saying now, and that just kind of sparks their interest a little bit more to saying, okay, what else can I do? And then when I need that help of when I'm trying to decide between the French fries and the salad, should I take the salad or the French fries? And that you can call on the help of the Lord, even in those little times you feel like they're little, because He delights in every single detail of your life. And people are like, oh, I didn't think about that. I didn't think that I should ask the Lord for help in this aspect, because I thought He just cared about if I'm telling people about Jesus and all that kind of stuff. And I'm like, well, He cares about that too. But then you're telling them that you're too tired. You're just trying to get your work done. You just want to get home and get on the couch. So we need to actually bring energy to you to help. And I actually started practicing in the South. And so a lot of patients I had were already in the church. And so it just kind of naturally came that I started talking about that, because they were like talking about their faith and stuff of that nature. And they're like, oh, I didn't know. They think doctors aren't human at times or something. Like, of course, I go to church, I pray, I do these types of things. And so it was just a different angle to actually connect with patients that they already had there, but just having them use it in a way that actually helps their physical health also.
Ah, thank you for sharing. And that makes sense. And thank you also for breaking it down. Because I think for people who have whatever your spiritual belief is or your religious practice, it can seem like this is the box of my spirituality or my religious practice. This is the box of my health. This is like my work. We kind of keep these things separate, but
Mhm.
our whole body's connected. And even our spiritual health is connected to our physical health. So thank you for making it very practical that people can, if you're struggling to go to the gym or you want to eat the French fries versus the salad or the chocolate, you can pray. So I think this is like very practical and realistic for a lot of us on a day-to-day basis. The next question I'd like to ask you is a little bit more about specific conditions. For example, a lot of people have diabetes. Maybe that's one condition. I'll start with diabetes. So say they're taking medications for their diabetes and they're on a lot of medications and they've never heard anything about how lifestyle medicine or what they can do to actually improve their diabetes. What are one or two practical things you'd say to a patient with diabetes who's already on a lot of meds? What can they do to help with their diabetes, help manage it?
So you asked that, and I'm like thinking, what have I done with patients before? So usually I know them. So we have a relationship already. And so if I know that they have a spiritual aspect, then I usually quote one of the scriptures in where Jesus asked the man at the pool of Bethesda, do you want to be well? Because some people don't want to. They're like, just give me my pill. I'm going to go on and eat what I want and do what I want. So for that, it's like, no matter how much I talk and how much I try to convince you, you're not going to change if you don't want to change. So I asked them, why do they want to change? What actually will keep you going? Because the French fries are louder than a salad. I'm just going to tell you, I know the struggle is real. I'm here with you. Like I said, I'm in this journey with you. And so you just want to actually know, like, what would that be? And then I have them actually look at what they actually eat. So I always start with nutrition, even though we have the 6 pillars in lifestyle medicine, because I believe that nutrition makes the biggest impact, especially for reversing chronic illnesses. Like if you don't change your nutrition, you don't change really the chronic illnesses for the longer term. And I got that from another doc when I was learning about nutrition, when he said you cannot out exercise a bad diet. And because I was an exercise person after I learned to do things for my own health. But then when he said that, I'm like, okay, nutrition has to be number one. So we look at what they're eating and try to make small changes in their eating habits. So everyone is different, what they like to eat, and see where we can go. And so I try not to tell people they have to take things away unless it's like something that's just over too much. Like if they're going to McDonald's every single day for every single meal, we got to cut that out, you know. But if it's like something that they're like, I'm trying to do this, I tell them to add in vegetables to every single meal. That's the most important thing, because most of the time, especially in the US, we are fiber deficient, not calorie deficient. So we need more fiber in our diets, which actually helps decrease inflammation and things of that nature to help people with their overall health. So if we can add in vegetables to every single meal, you don't feel like you're losing out on anything, but you actually are doing better. And then we try to take away something. So we try to add in and crowd out and then take away something that's probably making the biggest impact on your health at that time. So for diabetes, I look for people that's eating a lot of saturated fat. So cheeses, processed meats, or sodas, even if it's soda that's diet soda, because that artificial sweetener can kind of trigger things for some people with diabetes. So we just have to be careful. So I have them look at that and really reflect on what they're eating and their lifestyle, and then try to go from there. And usually they start to feel better. They start to see their blood sugars come down, and then less and less medication over time. So whenever I say over time, people are always like, well, how long is this going to take? And I was like, well, you didn't develop diabetes overnight, but if you actually follow these things and be consistent, you'll start to see this over time. Everyone's different because everyone had inflammation going on in their body at different times. So it's hard to say exactly, but you will start to feel better if you start to do these things. And as little as I was just saying earlier today, 3 to 4 days, like it actually make a difference. Your blood sugars actually can come down. You actually will have more energy. So it's positive reinforcement that we're really trying to go after, because when people don't see change and they want it now, then they're not going to continue on. So try to make you feel better before necessarily all the numbers move. And what we actually track for people with diabetes in internal medicine, especially, is like your hemoglobin A1C, which we know is like about a 3-month blood sugar average. So we're not going to see that necessarily change immediately. So you want to have some consistency to actually see that number drop, but you will see it drop if you continue on over time.
Okay, I love that. I love that. Thank you for breaking it down. And I really love how you personalize it first, because it's easy for us as doctors to try to feed all this information to our patients. And they're like, nah, just give me my prescription. I'm good. I don't want to do this. So I think that's very important that you try to gauge their level of readiness for change, how much they want it and why. Because I think it's easy for us to be like, yeah, I want change. And then we don't know why, because everyone says this is what we should do.
Right.
But it's not really a personal why to it that is going to keep us going when we're not excited to keep eating vegetables or doing whatever we're supposed to do. So I think knowing your why is super, super powerful. And I think another practical step that all of us can apply is to add something first. I think adding the vegetables is fantastic. It's very hard to make changes. I think we all have these ideas or resolutions, and after a little while we fall off because it's too overwhelming, but baby steps. So just add the vegetables first. Then after that, you got that down pat, then thinking, okay, what am I going to remove from my diet after you're used to the vegetables? I think that's really, really powerful. It's very small steps, but really, really powerful. My next question, you keep on alluding to your story. I should have asked you from the beginning. Tell us what your story is with your health, because you kept on mentioning your story. If you're comfortable sharing that with us.
Yes, and I usually start out with this, but it was a changing moment for me was when I was a freshman in high school. So again, you heard my story about me wanting to become a physician. So I already decided that when I was in sixth grade, right? But I was not a healthy person. I was an obese teenager, an obese child. Actually, I go back and look at the pictures and see a definite change from like first and second grade to third grade in my weight and seeing like what am I to do. But as a ninth grader and growing up in Indiana at the time, we had to do in the early 90s what they called the presidential physical fitness test. I don't think they do that anymore, but if you did certain things, you get this certificate from the president at the time, and it was a big ordeal. But one of those aspects was you had to actually know your weight. And so they made us get on the scale. And so actually, I knew I was overweight. I knew I was tired. I knew I didn't feel good. I knew I didn't like the way I looked. But I weighed 199 pounds as like a 13 to 14-year-old teenage girl. And that was like a light bulb moment for me. It's like, okay. And I use this as my own example, but not to shame anyone else. So we don't necessarily focus on weight all the time, but that was just my own light bulb moment. And I said to myself at that time, I will never let two be the first number of my weight. I'm going to make some changes right now. And I've already seen my family members have heart attacks. My grandmother knew I wanted to become a cardiologist. I actually remember going to the hospital and seeing her being wheeled back into the operating room for her bypass surgery. And I was like, I do not want that to be me. So what do I need to do? So at the time I started exercising. I didn't know what else to do. Just like see people do it, exercise. I used to save my lunch money and buy those gadgets that you saw on those infomercials. I remember buying like the ab roller, the thigh master, things of that nature, right? So if you grew up in the 90s, you know what I'm talking about, the infomercials, right? So I started to do that and was successful losing some weight at the time, having more energy. And then at the age of 16, when I was just about to end my junior year of high school, I decided to become a vegetarian. And people are like, what? What made you do that? Again, I don't know. All things that God puts together to know I was going to do doing lifestyle medicine. He was like, I want you to have this story to tell people that you've been doing for a while. My cousin was a vegetarian, but I always joke with her and say people expected that from you because you were always eccentric. You know, you did things your own way and things like that. But they never would have expected that from me, that I always followed the rules. And that at the time, my father was a meat delivery truck driver. So we had bacon, hot dogs, sausage, bologna. You know, that's what we was eating all the time. And for me then to go and say, 16 years old, we have a job in the summertime type thing, telling my parents, I'm not going to eat this food anymore, right? So how does that go for people? I don't know what you're going to eat then. So so I started with just removing the meat from my diet. So it wasn't an extra burden. I would just be like, I would pick meat out of stuff. Okay. So that's how my journey started. And I remember telling this story to one of my friends that grew up with me and we connected later. And he was like, you haven't eaten meat since that time. I remember taking you to McDonald's and you'd be like, I want a Big Mac with no meat. And people thought you were kidding. And then you're like, no, I'm for real. I want everything but the meat on there. So I'm telling you, in the 90s, we were struggling to try to find some vegetarian food. Didn't know, think just eat some vegetables, right? You just like what I knew is what I tried to do, right? And so that's where I try to tell people it's not too overwhelming. Like you can just take what you know and do that until you know better. So yeah, I hadn't eaten meat since I was 16. Did that through all high school, college, residency. And then, like I said, when I was like practicing, one of my patients told me about Dr. Joel Furman and then the Vegetarian diet, and then also going to a conference for CME with nutrition, and the doctor saying you cannot out exercise a bad diet. And again, all these times I was still like losing weight, becoming more fit, being more active, and then learning about actually plant-based nutrition, and then actually changing that to actually eat more whole foods and actually becoming better, actually maintaining my weight even better, decreasing my risk for diabetes and high blood pressure, which run in my family. And I believe I was a pre-diabetic as a teenager. Looking back at the pictures, you know how you can see different physical signs and things of that nature, and reversing that for myself. And again, not really trying to tell this story to anyone else, but because patients were asking, and then they would say, well, are you doing it? And I'm like, of course I'm doing it. If I'm telling you to do it, of course I'm doing it, to actually tell you different tricks that I learned along the way. So it's been now well over 3 decades of life with no meat. And then people are like, you don't miss it? It's like, how can you miss something that you don't even know for now for half your life? I stopped eating meat so long ago, and to know that it's possible even in the midst of a culture where it was like always there. And so I always use that tell about my father being the meat delivery truck driver, because it's like that's the food that we had. So at that point in time, in that actual atmosphere, I decided I'm not going to eat it anymore. And again, I just think it was to be a part of my story to help people along the way in this lifestyle medicine journey.
Oh, wow. That is so beautiful. And there's so many nuggets you shared with us. The first thing I want to point out is that you were so mature to be like a 13-year-old, to step on a scale and to tell yourself, I'm not going to reach this number. I think you're already very mature to begin with, to have that ability to reflect and to make a decision and to stick with it. And then the other thing I'm very impressed with is you saved your money for all those gadgets. I think not only mature, but self control. Because I remember watching those infomercials. I'm like, it's too expensive. I'm just gonna go buy candy, you know? You have to have some kind of discipline and set your mind and be like, I'm gonna save the money and do this, and not get
Yeah,
the, how to put it, shiny object syndrome, and like forget about your goal after a little while.
that's
So
true. I never thought about that, but you're right. I'm like, I got to get this weight off. I need something. I'm going to do that. Yes.
yeah, I can see like a lot of maturity even in your decision to become a physician as a child, and then like I'm gonna do this, and to be a vegetarian at a young age too. I tried my transition. I don't know. I think it lasted maybe 5 years, and then I went back to eating meat because people were like, "Oh, so you're a vegetarian?" You know, like African people, like similar thing. You're a vegetarian? Okay, here's some fish, and you're like, "No, it's not the same
Right.
thing." Okay, here's chicken. I'm like, no, you don't understand vegetarian. So kudos to you to keeping up with that. I had to give up. I can relate. Like you'd always be the weird one at family meals or like get-togethers. People be like, "Nah, like this is weird."
Hmm. 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 Yes, exactly. Exactly.
So that is awesome. So thank you so much for sharing your story. It takes a lot of vulnerability, but thank you for sharing because I think there's a lot of nuggets we can take from that. Like, making your decision as to what you want to do, knowing your why, sticking to the goal, and being consistent over these years. It has paid dividends because you're mentioning you were probably pre-diabetic and now you're very healthy. So that is amazing that you've been able to stick to your goals for that long. And for our audience members who are watching, who are loving everything that you're saying and they're looking for a doctor like you, how can they work with you? How can they reach out to you?
Yeah, so they can actually go to my website at www.dramandamd.com. They can book appointments with me. I do have my Atkins Enlightenment Lifestyle Medicine is a virtual practice, and so I am licensed in 10 states in the US, and on the website they tell you all those states. But if you unfortunately do not happen to live in those states, I do work with people with coaching with just lifestyle medicine part, not the medical part, but can still help you with dividends of changing your health. So everything is on the website. You can go to our social media links from there, YouTube channel from there. So just go to the website and you'll be able to find everything.
Okay, we'll make sure that we have all your social media handles below so that people can connect with you. But thank you again for taking the time to talk with us, for sharing your story, and for sharing very, very practical tips that can help people improve their health. I think for me, the big takeaways are adding something first. So I'm going to be adding more vegetables, thinking about even with my goals, adding rather than I have to do this thing. I'm adding something to my life. And I think the other thing, yeah, being like decisive, and sticking with something. Because I mean, 30 years of being a vegetarian, that's powerful. Wow. I think some of us are sticking to things for 30 minutes. So 30 years is powerful. Thank you for
Yeah.
sharing.
Thank you so much for having me. I enjoyed talking to you today.
All right. And to all of our guests who are watching the show, thank you for watching. Bye bye for now.